A deadly new virus that has infected more than 200 people in China can be spread through human-to-human transmission, experts revealed today. The new coronavirus comes from the same family as SARS, which killed nearly 800 people, including 44 in Canada from 2002 to 2003. The virus originated in the city of Wuhan, but there have been cases reported in Beijing in Guangdong province. And there are real fears the outbreak could spread to other countries during the busy travel season for the Lunar New Year. The Public Health Agency of Canada just moments ago finished a briefing on the situation. It says the overall risk of the disease spreading to Canada is considered at this time low, but the agency will be implementing measures, including warning signs at major airports this week. So is Canada doing enough to prepare for the possible spread of this virus? Joining me now from Toronto is Tony Clement. He was Ontario's health minister during the SARS outbreak. Hi, Mr. Clement. Nice to see you. Thanks for making time for us.
No problem.
I want to be clear off the bat here that the risk to Canada, as we said from the Public Health Agency, is currently assessed at low for this new strain of coronavirus. However, it has been identified in 4 countries, and China confirmed that there has been human-to-human transmission. You have been there before in your capacity as Ontario Health Minister during SARS. From your experience, can you sort of shed some light on what might be happening behind the scenes right now?
Well, here's a couple of the problems that we have to face head on. First is that Chinese authorities were not very forthcoming during the SARS outbreak when and where things were happening, and so we were behind the 8 ball in responding to things. So if that's still the case here, that's never a good sign. Secondly, the problem with some of these diseases is that when you contract the disease, you may not have symptoms for several days. With SARS, it was a 10-day incubation period, so you might be able to pass through an airport screening process, not display any symptoms, and then come down with the virus a few days later. So airport screening sometimes is ineffective. In this case, we do have a better pandemic plan than we did back in 2003 when SARS hit, and certainly our hospitals should be notified. There should be enough antiviral medicine like Tamiflu available, and the pandemic plan should be activated in an abundance of caution. Vashi, you're right. The risk right now appears to be low, but you should always hope for the best and plan for the worst.
Let me circle back to something you mentioned off the top there, and that was that Chinese authorities in the past have not exactly been very forthcoming. How do you as a government sort of address that fact? How is there any way to find out, for example, if they are being forthcoming enough, or are there mechanisms in place? I know the WHO is meeting, the World Health Organization on Wednesday. They're convening an emergency meeting. Like, are there mechanisms to figure out whether or not that's the case?
Yes, I think you've hit the nail on the head. The World Health Organization does have to get involved. They have to get pandemic health experts on the ground in the affected province of China to see what is going on, away from the city centers perhaps, and certainly in the city centers. So there are things that can be done. Public health experts can be in the field, and that's what you need to have happen almost immediately.
They're also at that meeting going to be discussing, or determining rather, whether or not the outbreak warrants being declared a global health crisis. If that kind of crisis is declared, how does that change the way in which governments in other countries have to look at this?
Well, then they activate different protocols, and what I'm advocating is to activate the protocols even before that. Obviously, we don't want panic, but at the same time, I think that Canadians deserve to be on top of this. The government officials, Public Health Agency, the Health Minister have to give regular briefings on this as we're going through this. With the problem under SARS 17 years ago was, by the time the world found out that there was this pandemic happening in China, people were traveling all over the world with SARS, including into Canada. Our hospitals were not aware of it. They were transferring patients from one hospital to another, and they contracted SARS and so forth. It ricocheted through the system. So you don't want to make that mistake, and that's why the pandemic protocols should be in place right now.
So you would be advocating for, even though the risk is low at this point, just given the experience with SARS, kind of operating out of an abundance of caution?
Abundance of caution. Actually, I remember the first briefing I had when SARS was just, it wasn't even called SARS, it was so early on. And, some of the advice I received was, don't worry about it, everything's under control. And I said, well, it doesn't sound like it's under control, and it sounds like we should be worrying about it. And I think that if you want to be criticized for something, let's get criticized for overreacting rather than underreacting. It could save many lives.
Is there a risk, though, of sort of creating, and like you said, I know you prefaced everything by saying, and same with us, you don't want to create an atmosphere of panic, but
no.
Do you run that risk by upping those precautions at this juncture?
I think at this juncture, most people wouldn't even know what the protocols were when they're activated. It doesn't change living in a city like Toronto or any other major city center or anywhere in Canada for that matter. But it means your hospitals are just, they're just taking that extra precaution. The airports are taking that extra precaution. These are things that I think are prudent in the circumstances.
In preparing for this interview, I was reading through a number of pieces that were done back around 2002, 2003. There was a lot of disconnect at the time between provincial governments and specifically ones like yours at the time that had seen firsthand some of the impacts and at the time characterized as a bit of a delayed reaction from the federal government. Do you think that there have been lessons learned from SARS that would mitigate that kind of lack of communication or lack of, I'm not sure what the right word is, but do you think things have...
Coordination.
Yeah, coordination, that's it, thank you. Have things changed? Were the lessons learned? Do you expect a different response this time?
Yes, I do, frankly. When I became federal health minister, one of the first things I worked on was a national pandemic response plan so that there was greater coordination with public health officials, greater coordination with public health agencies and health ministers. So that should be in place right now. But there's levels, right? So right now we might be at the lowest level of coordination. What I'm saying is up the coordination, up the communication, have that in place right now. So in case there is a worldwide pandemic that is issued by the WHO, the World Health Organization, we actually already have a lot of the protocols in place and activated. And
are you specifically talking about, when you talk about protocols, for those of us who aren't well versed in that, do you mean at airports, more stringent than the signs or the extra question that they're adding? Does it mean more screening? What exactly do you mean?
Yeah, again, the screening is only partially helpful. As I said, you may be asymptomatic. You may not display any symptoms, not even know you have the virus when you're passing through. It helps, but it's not the cure-all. What I mean is hospitals, maybe the hospital transfers are reduced or eliminated because that spreads the disease in the hospitals. And public health agencies have more alertness that there may be a particular vector in their area. So these are the kinds of things that can be done, and can be done without panic. This is just raising the level of awareness, raising the level of preparedness for anything that could be coming down the pipe.
Okay, I'll leave it there. Thanks very much, Mr. Clement. Appreciate your insights this evening.
Thank you.
That's Tony Clement, former Ontario and federal health minister. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.